According to the CDC, more than 46 million Americans live in rural communities, and that includes here in Montana. While there's many perks to living outside of the city, many do face big challenges in terms of accessing health care.
We didn't know for sure what was going on.
It's a nightmare Cheryl Donovan will never forget.
I was just hoping that we made it. We made it in time. I was hoping we could make it in time.
Cheryl's husband, Dale, was suddenly overcome by West Nile virus last August and was quickly rushed to the hospital in Sydney.
I think we got there about 2 o'clock, and by 3:30 a.m., we knew we were flying out somewhere.
The Donovans live in a small North Dakota town called Trenton, population 735, and quickly learned that Dale needed to be sent elsewhere. Donovan was life-flighted to St. Vincent Healthcare in Billings, where he spent 10 days in a coma.
But it was very emotional that first 10 days because we didn't know if he was going to come out.
Donovan's story is unfortunately very common in Montana.
It's a big gap in rural America, and Montana is unfortunately the leader of that, if you will.
And according to a new report from the CDC, people in rural counties have a higher chance of dying early, a struggle St. Vincent's trauma director Barry McKenzie sees daily.
It's a long way to travel, and they may not have vehicles that can make that distance, or they got to stay and take care of farm and ranch and other commitments and stuff.
Nationwide, around 20% of the U.S. population lives in rural areas. The CDC study estimates that 6.37 million Americans have died prematurely over the last 12 years, with 64% of deaths from unintentional injury, which includes car accidents, falls, and unintentional shootings, as being preventable if patients only would have had faster access to health care.
As a level 1 trauma center, we've had to look at ways to help support that, to provide those resources and training that can really be at that patient's bedside as soon as possible.
A focus for St. V's and other Montana hospitals, and one much appreciated by families like the Donovans.
I was glad they were getting him out of here because I knew Williston or Sydney weren't capable of taking care of the needs.
In Billings, Charlie Kleps, MTN News.